What kind of impact did school closures have on community spread of COVID-19? A recently released study looked into just that, and their findings suggest lengthening school closures would have made very little difference at all.
So this study, we took a look at a really unique period of time in Ontario.
The study, conducted by the Institute for Clinical Evaluative Sciences, began during the province-wide shutdown in December 2020. The shutdown was followed by a regionalized approach to reopening schools, which lasted through January and February of 2021. The researchers estimate that only 213 fewer cases of the virus would have been reported if schools had not reopened during that time. That equals to less than a tenth of a percentage point in cases.
We did look at really small communities, something called a census division. So it's a lot smaller than a school board or a public health unit. And we also considered differences within those really small communities. What was the age distribution in those communities? How many tests were being completed? How socially deprived are people living in those communities?
Tiffany Fitzpatrick is the study's lead author. She says these results show that any increase in case growth after the reopening of schools may be manageable with appropriate mitigation policies, such as reducing contacts through smaller class sizes and masking.
What our main takeaway was when you have all of these other community and school measures in place, we can safely reopen schools.
Whether or not it was safe enough to reopen schools was a highly debated subject, with many opposed to school closures during the pandemic, highlighting the negative psychological impact staying at home could have on children. Ontario's COVID-19 Science Advisory Table supported the decision for kids to return to the classroom in January of this year because of the minimal risk of transmission within schools.
That this study didn't consider that there are long-term impacts associated with COVID-19 that are really important to consider, and also, all the other health and social well-being that goes behind schools are really important to consider when making this policy decision.
The researchers want to emphasize that the study was conducted in 2020 and 2021, when we did have more restrictions in place and before we saw variants of concern like the Omicron variant. Melissa Nakavali, City News.